Led goals by Harry Kane and Harry Maguire were amongst such that automotive England to their top Planet Cup productivity with 1990. But can repeated header reason harm to the marrow and conduct to length-term public health problems? A new research of 300 ex-vocational players urged to reply the issue. The schedule is to put the players, elderly among 50 and 70, via a episode of tests intended to evaluate their natural and cognition capabilities. Down there will be clinic examinations and information will be collected on the player's career in the play and way of life factors. The will enable comparisons among defenders and centre forward and some players who tend to chief the dribble less than frequently. The research will be transferred out by the London High School of Hygienic and Tropic Medical, LSHTM, Tsarina Mary College of London, and the Institution of Professional Medical. The testing results will be compared in such of a general people research named as the 1946 childbirth group that has controlled the aging trial in a team unborn in how year. The new research will be such to one that the Rugby Football Soccer Association embarked on in 2016 to evaluate the length-term effect of concussions skilled by ex-players in England. Both of are underfunded by the Duck Basis, a no-for-profit organization focus on study on shaking injuries in kind of sports. Conduct investigator Professor Neil Pearce, of LSHTM, told, "We aware how down there are enlarged risks of neurologic disorders of chief trauma in sport such as box. Yet, we don't aware lot on the risks of shaking in soccer, and we aware nearly anything on the length-term effects of header the dribble often. The research will ensure, for the at first period, convincing testimony of the length-term effects on cognition feature of vocational soccer." News story of the newest research follows growing discussion on the connection among repeated header and shaking injuries and marrow diseases such as imbecility and Parkinson's. In February 2017, researchers of College School London and Cardiff College published a research relying on position-mortem examinations of the brains of 6 ex-players that found signs of marrow trauma in 4 persons' cases. He allocated the instance of Jeff Astle, who played for Western Bromine and England and advanced imbecility up moribund at the age of 59 in 2002. A pathologist controlled how Mr. Astle's marrow had been corrupt by year of header a soccer. Alan Shearer signed how really slight has been made to explore the effects of header a dribble. I discover how overwhelming. In November 2017, the Soccer Associate and Vocational Footballers Associate announced they were financing a research run by the College of Glasgow and the Hampton Sport Hospital looking at natural and psychological public health outcomes in ex-players, relying on analysis of care accounting records. The crew, led by neurologist Dr. Willie Stewart, will address the issue: is the percent of degenerate neurocognitive illness more than overall in former professional footballers rather than in the regular people? The new study is understood to be the at first of its type in the UK to engage interviews and tests on ex-players. James Duck, president of the Duck Basis, told, "Lot human beings include weighted lot year for a research love the Duck Basis is pride to be financing the job and to be a portion of the essential move forward in our insight of sport-related shaking and its length-term effects." Gordon Taylor, of the Vocational Footballers Associate, welcomed the add. To the recent too many decades the question of chief impacts, chief injuries, concussions and neurodegenerative illness in ex-players has been of lot anxiety to all at the PFA and our responsibility of thoroughness to our members.